And this morning, the Department of Health's COVID Vaccine Subcommittee will be meeting to discuss booster surge planning here in Rhode Island.
Yeah, this comes as the FDA is expanding access to booster shots of Pfizer's vaccine. And Kayla Fish is in our studio this morning with a look at who can receive this extra dose.
Well, the FDA is now authorizing emergency use of Pfizer's COVID vaccine as a booster shot, which the White House is calling a major step forward. But not everyone is eligible. This decision only applies to people ages 65 and older, as well as people with underlying health conditions and people who work in high-risk environments like hospitals, schools, or homeless shelters who may be frequently exposed to the virus. Now, the third dose would be given 6 months after people in these groups received their second shot. It's now up to the CDC to decide how and when the boosters would be distributed, something that Rhode Island leaders will also be discussing this morning during RINO's COVID Vaccine Subcommittee meeting. The FDA did stop short of the Biden administration's original plan, which called for all Americans to get a booster shot 8 months after their second dose.
One concern related to benefit-risk balance in the general population of individuals 16 years of age and older. A second question related to the data and level of evidence to support the safety and effectiveness of a booster dose.
Now, the FDA is still reviewing data regarding boosters of Moderna or J&J, but that decision could come in the next few weeks. This morning's Vaccine Subcommittee meeting is being held both virtually and in person at the Department of Administration. 12 News will be monitoring the meeting and bringing you the latest, both on air and on WPRI.com. Live in studio this morning, I'm Kayla Fish, 12 News.
And the FDA is giving green light for more people to get Pfizer's COVID booster shot. That's going to pave the way for the U.S. to start administering third doses to seniors and for other people at high risk. So booster shots also top of mind for Rhode Island health leaders who will be discussing the rollout for these extra shots later this morning. Kayla Fish is joining us in studio. And Kayla, the boosters are not yet available for everyone.
Yeah, that's right, Danielle. So Rhode Island is already administering third doses of the COVID vaccine to people who are immunocompromised. But this morning, the Department of Health's COVID Vaccine Subcommittee is meeting to talk about how to plan for a booster surge. The meeting comes as the FDA is expanding access to Pfizer's booster shot, approving it for people ages 65 and up, younger adults with underlying health conditions, and people who live or work in places where they may be frequently exposed to the virus. The CDC is still discussing who should get the extra shots and when, a vote that could happen this week. As the U.S. gets closer to its COVID booster campaign, the White House is also pledging to get first shots to other countries around the globe.
To beat the pandemic here, we need to beat it everywhere. The United States is buying another 500 million doses of Pfizer to donate to low and middle income countries around the world.
Now, today's Vaccine Subcommittee meeting is also focusing on the vaccine requirement for Rhode Island healthcare workers, according to the agenda. Stay with 12 News for more details from the meeting, both on air and on WPRI.com. In studio, I'm Kayla Fish, 12 News.